Good afternoon, everyone, and let me just adjust my camera a bit. Yeah. Okay. Yes, today the topic is adult cardiac surgery, and we'll be talking about CABGs, aortic replacements, and of course, minimally invasive cardiac surgery. Although we have had a session on that, so we'll just touch upon that. But mainly, the focus of the class will be CABG because that's a life-saving procedure and the most common one. And I'm Dr. Shagun, and I work in the UK. And let's start the class. Now why does this class matter? Because cardiovascular diseases still remain the number one global killer, where surgery remains the definitive treatment in advanced diseases, where the PTCs don't work, where the stents don't work anymore, and you have to intervene. And the outcomes usually. So based on these lines, we have designed the learning objectives. So we need to understand the core cardiac surgical procedures, which we'll be talking about in detail throughout the class, how to apply the decision-making frameworks, when to do what and how and why, of course, and then recognize the post-operative priorities, which is very, very important. If you've done everything right, everything correctly, but the nurse in the post-operative period was not skilled enough, was not vigilant enough, and the patient lands up in an emergency at 3 a.m. in the night in the ICU. And of course, you just completed your 12-hour surgery and now you were resting, but the nurse was not vigilant enough. The entire thing goes into the drain. So, yes, how to recognize these post-operative priorities, how to train your nursing
Heart
staff.
surgery. Sounds scary, right? But for millions, it's life-saving. When the coronary arteries get blocked, blood flow to the heart is significantly reduced. That's where cardiac surgery begins. Highly trained surgeons take control. A machine temporarily replaces your heart function. New pathways are created for blood flow. Every move is precise and calculated. And slowly, the heart is restored. Recovery begins in intensive care. Within days, patients start improving. And step by step, life returns. Back to family, back to living. Don't ignore chest pain. Early action saves lives.
So, yes, that's how you take real life decisions. And now about complications of CABG, of course, bleeding, stroke, that is cerebrovascular accidents, graft occlusion, of course, and atrial fibrillation, where AF is the most common one. And we'll talk about it, about how to, as a whole, after cardiac surgery, how to minimize complications at the end of the lecture. Now, that was about CABG. Coming to aortic surgeries now. Well, the most common pathologies of the aorta that we see are dissection, life-threatening, of course, aneurysm, and aortic root disease. And just to mention about the classification for aortic dissection, DeBakey classified as type 1, 2, and 3, where type 1 is involving the entire aorta, type 2 is just the aortic root, and type 3 is the descending aorta. But this didn't help us in deciding which surgery. Now, when there is cardiac failure or heart failure in layman's language, sometimes surgery can be required. And when is it treated? When it is needed, when it is an end stage heart failure. It's a young patient but has some cardiomyopathy, but has end stage heart failure, then you will require surgery. And if a cardiac failure is refractive to medical therapy, then the surgeon will need to intervene. So, ventricular assist devices can be, of course, implanted. What they do, they will bridge to the transplant. And of course, there's a huge waiting list for a heart transplant, definitely. So, yes, to buy time, we insert ventricular assist devices which take blood from the ventricle, left ventricle, and pump it into the aorta, doing the heart's job.
CABG saves lives. But what if I tell you the real danger starts after surgery? First, bleeding. Post-operative hemorrhage may require urgent re-exploration. Infections. Sternal wound infection can turn life-threatening very quickly. Arrhythmias. Atrial fibrillation is the most common complication. Myocardial infarction. Yes, even after bypass, a heart attack can still happen. Stroke, caused by embolism or low blood flow during surgery. Acute kidney injury, higher risk in elderly and diabetic patients. Graft failure, blocked graft means symptoms can return. Pulmonary complications, atelectasis, pneumonia, prolonged ventilation. And don't forget, post-pericardiotomy syndrome. CABG success isn't just surgery, it's preventing complications.